As coronavirus spreads and people stay home, doctors and patients are adapting to the new reality of telemedicine. CBS 2's Nick Caloway has this.
We went in mid-March from 20 video visits per day for Mount Sinai to 2,000 in a matter of 10 days.
Dr. Ronald Tamler is an endocrinologist and director of digital health implementation for the Mount Sinai Health System. As the coronavirus pandemic rages on, Tamler has trained more than 1,000 doctors in all specialties the skills necessary to use telemedicine to see patients.
You don't have to leave the confines of your home. You can do multiple doctor's visits. You don't have to take the full day off from work to go to a doctor's office.
This was an absolute game changer for me.
Sherry Ross is one of Dr. Tamler's patients. She has type 1 diabetes and needs to constantly keep in touch with her doctor.
It worked out so well because I left the city because I wanted to protect me and my family, and I wanted to keep my appointment.
Dr. Tamler says you'd be surprised what can be diagnosed using video technology.
You can see whether a patient is having trouble breathing, whether they're gasping for air. You can see whether they are anxious.
But he says there are limitations.
Everything that has to do with feel. For instance, I would not be able to feel your thyroid for nodules. That's something that one can only do in person.
With telemedicine restrictions being waived due to coronavirus, doctors of all specialties across the country are now seeing patients this way. Dr. Tamler says he expects the wave of telemedicine to continue even after coronavirus.
In the longer term, as people are going to get used to having video visits, they're going to demand it because it is just much more convenient for them.
But he says if you have a telemedicine appointment with your doctor, be sure and do it from a private place with good Wi-Fi, preferably from home. Nick Caloway, CBS 2 News.